A shrine to Dr. Li Wenliang outside the hospital where he died, a martyr to telling the truth. He was one of 8 medical officials who reported the outbreak at the start and was reprimanded by the Wuhan police for spreading rumours. In Hong Kong, they understand the relationship between secrecy and the spread of the novel coronavirus, which has entered the territory from mainland China.
He's the first group of people who has discovered this disease, and he's willing to speak up the truth. And unluckily, the truth was not spread around early. So that's why things happen like this.
The way they do things is secretive, and this is the result. This is the difference between a society with democracy and one without.
As news of his death spread, millions of Chinese posted their anger and grief on social media, with memes about how he'd been gagged. The people's hero, a whistleblower. Others saying Chinese people wake up with the hashtag "We demand freedom of speech." But as soon as the posts go up, they're pulled down. This content no longer exists, it says. His mother spoke to Chinese media. At a press conference in Beijing this morning, health officials expressed condolences. Trying to co-opt Dr. Li's hero status and reduce popular anger. They'd much rather talk about how they've nearly finished building a second 1,000-bed hospital in Wuhan at record speed. That's the advantage of an authoritarian regime. You can get things done. But the image of an efficient, modern healthcare system is at odds with what Wuhan citizens have filmed. Patients are packed like sardines in a new quarantine center in Wuhan. Medicines are in short supply, and they say basic hygiene isn't observed. The potential for further rapid spread is obvious. In Chinese cities, people are blowing whistles in honor of the whistleblower Dr. Li Wenliang, and isolated in their apartments in Wuhan, shouting in his support. They've been posting the lyrics from the Les Miserables anthem, "Do you hear the people sing?" It's not clear that Chinese officials do.
Well, Thailand now has 25 confirmed cases of the coronavirus, and its capital, Bangkok, is now considered the most at-risk city in the world outside of China for spread of the infection. Our Bangkok correspondent, Jonathan Miller, has spoken to doctors and officials tasked with tackling the virus, who admit they may only be able to delay its spread rather than contain it.
The land of smiles has gone incognito. Bangkok, city of angels, now the city of masks. At Erawan Shrine, they pray for good fortune. In uncertain times, with so many unknowns, there is just hope and prayers. Coronavirus, the unwelcome visitor, has caused quiet panic. Quality masks have long since sold out, as has hand sanitizer. Behind the masks, sometimes you sense fear in those eyes. Thailand's public health minister, Anutin Cheerwirakul, was handing out flimsy surgical masks this morning. He had a go at Western tourists for refusing to wear them. Unbelievable, he said. We should kick them out of the country. I paid him a visit at his public health ministry.
Swadikap. Good morning, Minister. Very good, thank you, sir. Do you feel everything's under control?
Well, we have to take precaution. We don't feel comfortable. We feel confident with our system. I'm confident with our doctors. I'm confident with, our people.
Do you believe it can be contained before it becomes an outbreak?
We have done our best, and so far so good, isn't it?
At the heart of his ministry, the War Room, as it's called, a 24/7 coronavirus command centre. Thailand, site of the first human-to-human transmission outside China. Bangkok ranked the city most at risk in the world due to its profusion of air links with China. Chinese tourists, 10 million a year, lifeblood of the industry here. Their numbers have now plunged